Hello, everyone. This is Dr. Ivory. It's so good to see you this evening. This is day number 3, and I'm excited to be here. We're going to talk about medication and treatment as part of our Coping with COVID-19, a community mini-series. Now, I continue to have intermittent technical difficulties, but we're working on that. We're going to go back and edit the first 2 days to make it shorter because I've been hearing feedback, and it's been positive feedback that people appreciate the information, that it is good information, but it's taking too long. So today, the goal is to get you the information and to get it to you in 10 minutes or less. And here we go. So, medication and treatment. That's what we're going to talk about today. We talk about the legal disclaimer. Once again, nothing that we talk about is to be construed as medical advice, as if I'm telling you this is that you are sick and you should do this and you should do that. It is providing information in terms of what we know about COVID-19 infection and the other subject matter that we're speaking about that particular day. We are not here to diagnose, treat, prevent, or cure any disease. And we remind you that participating does not create a physician-patient relationship. We do not want you reproducing this telecast and then selling it. If you share it with friends and family, that is perfectly acceptable, but you are not to charge for it. It is not to be part of any business that you are running, because I am giving this out free because it's public health and everyone needs to know it. So I expect that you will share it without any cost. Now, I appreciate it. If there are any questions, comments, or suggestions, feel free to put them in the comments below. You can direct message me through the Facebook page, or you can email us at contact@femalematters.com, contact@femalematters.com. So let's get on with it. Medication. When we talk about a medication, what is it that we're looking to accomplish? This is a brand new virus. We know nothing about it. In the last 4 months, we've learned quite a bit, but we're still trying to get a handle on what the virus is, what it's doing to the body, who gets sick versus who doesn't get sick, who are the people that are asymptomatic even though they're infected, and who are the people that never got infected. We don't know any of those answers very well. Part of trying to figure out a medication is starting to understand the disease and what it's doing to the body. So keep that in mind. As we learn more about the disease, then there is more information available to help with the development of a medication. A medication needs to do several things. It needs to kill the virus, because the point of the virus is to make more of itself so that it makes it easier to infect the organism or other organisms around it. We want to cure disease. The next thing we want a medication to do is to decrease the time that somebody is sick and decrease how sick they get. Those two aspects are very important. How can we keep people from getting really, really sick and ending up on a ventilator? How can we keep people from ending up in the hospital for 13 or 14 days or more? We need a medication that's well tolerated, one that doesn't have very many side effects and can be taken easily, something that's affordable. And we know that's an issue here in the United States, but the reality is we're looking for a medication that's affordable so that it's available to anyone and everyone who needs it. It also needs to be accessible in terms of ease of use. If it requires a special hospital and special needles and special staff to inject it into you and you have to be watched for 8 days, that's not what we're looking for. If it can be distilled into a tablet, a capsule, something that's easy to take by mouth and can be distributed out without needing to be refrigerated or heated or mixed up, that's what we mean by accessible and easily used. And finally, it needs to be reliable. When you take the medication, it needs to work. We need to know it's going to work and not have to worry about it. What medications do we have now that meet that criteria? We actually have none. Despite what you're hearing in the news, there are no medications that are proven to impact this disease in a positive and powerful and reliable manner. And all of those things count. Because somebody got better after taking the medication does not prove that the medication itself works. When we talk about a placebo effect, that's the effect of you believing that a medicine will work simply because it's being used. And we think that occurs in about 30% of the time that people are given medication and they know what they're getting. That the notion that I believe it's going to help me can have some impact. The studies to prove that a medicine works are going to look to see that there's a bigger difference than simply something like placebo with regard to what's happening. Excuse me just a second. Because of course I forgot to put do not disturb on today. So let's get to the next one. The first medication, hydroxychloroquine, which is plaquenil. That's the trade name in the United States. That is the medication that is being promoted through the federal government. That is the medication that's being promoted on a lot of media sites. And it got promoted because there was a study that suggested that plaquenil will help decrease how severe the infection can be and may even help decrease the likelihood of getting infected. It's assumed that it works by decreasing the ACE2 receptors. And remember, we talked about that yesterday in terms of how a virus invades and what this particular virus is targeting in our bodies. The suspicion is that plaquenil can actually decrease the amount of receptors, but it's not clear that that happens. And certainly there are studies that are showing that when patients are severely ill and in the hospital, that plaquenil is actually not making much of a difference with regard to their improvement. Now, we don't have the standard type of study where we take a group of people and we blindly assign them to get the medicine or to get what they think is the medicine, but it's really fake, and see what happens. So that's a double-blind, randomized, controlled study. We don't have the ability to do that at this point. And until that's done and we do it in enough numbers that we know we can say, yes, there's a difference because we tested enough people, then right now we just cannot say that plaquenil works. It's not proven. People are using it. We're getting usage information. And if enough information is out there suggesting that it makes a huge difference, then we need to look at it. The problem with plaquenil is side effects. Plaquenil can cause an irregular heart rate that can be bad enough for sudden death, which means that if you're taking it at home and experience one of these episodes, you can have sudden cardiac failure and not make it to the hospital alive. So we really don't want people taking plaquenil unless it's under the doctor's care and surveillance. The other thing is plaquenil can damage the liver. And that's another issue that we do not need in a severely ill patient. But more importantly, we do not need patients who aren't ill, who now have liver issues, liver dysfunction, because they've been taking a medication that they thought might help, and we just don't know that it will. The next medication in combination with plaquenil is azithromycin, which is a Z-Pak. And that's a standard antibiotic. It's very common. Most of us have been on a Z-Pak if we've gotten a bad cold or bronchitis or something like that. And the azithromycin is designed to prevent getting infected with a bacterial pneumonia or other bacterial infection while you're sick with COVID-19. Now, there's several issues with taking Zithromax. Number one, in combination with plaquenil, it makes it very much more likely that that irregular heart rate situation can occur. And that is very worrisome, that people can really literally drop dead if their heart rate becomes abnormal enough. And the combination of these two medications is not a good combination for that side effect. The other thing about Zithromax, we don't like giving out antibiotics just to give them out, just to prevent infection, because of the amount of resistant antibiotics out there. There are so many bacteria, resistant bacteria. There's so many bacteria developing antibiotic resistance that we need to be very, very careful that we only use antibiotics when we know they're going to work to treat a specific infection. So taking Zithromax in a Z-Pak with plaquenil, trying to prevent getting COVID-19, or if you have very mild symptoms, making yourself feel as though you're not going to make your infection worse, the side effects can be worse than the mild infection. And what we'd ask you to do is not take those medications unless they're under direct physician orders. Plasma therapy. Now, if you followed any of the briefings in New York, plasma therapy has been talked about, and that's being studied. What that is taking the liquid part of blood, plasma, and taking that from patients who've already had COVID-19 and recovered. Because the assumption is that they have antibodies in their blood that now will protect them against coronavirus. And we want to be able to provide those antibodies to people who are sick and having a difficult time recovering. That's the point of the plasma therapy. We know that has been successful in the past because before we had antivirals to treat things like chickenpox and herpes and AIDS, plasma therapy was used. We don't know how long the antibodies last. We don't know what's happening in terms of the success rate, but the suggestion is that providing antibodies to sicker people will help their immune system fight off the COVID-19 virus and, COVID-19 infection, and then they should get better faster. So plasma therapy is in the works. The way to get plasma is for a hospital to get it from the blood bank. So people who have had COVID-19 have been encouraged to donate plasma to increase the stockpile of plasma that's available. We do not know how effective this is. We don't know how well people develop antibodies to COVID-19, especially if they have very mild infection. But it's something to consider, and for now, that is a treatment that is undergoing experimentation that we have very high hopes for. Steroids. It's not uncommon to be prescribed steroids if you go into the urgent care or go to your doctor or the emergency room with shortness of breath, you have difficulty breathing, you're coughing, you have bronchitis, other infections. The steroids are there to calm down the immune system. It is not clear what role steroids should play in COVID-19 infection. There are definite reports that high doses of steroids are not helpful, that it does not decrease the likelihood of severe infection, and it may interfere with healing and improving once someone does have severe infection. So we do not want people taking steroids ahead of time in case they get a mild case. They want to get rid of it. It may increase the risk of a more severe case. So steroids are discouraged for people who are not already taking steroids for other medical problems. Now, whatever medicines you're currently taking, we want you to stay on those medicines, including blood pressure medicines that may be ACE inhibitors. There is no evidence that if you come off of your ACE inhibitor, that it will decrease your chances of COVID-19. There's no evidence that staying on it or coming off it will increase your risk. And we do know that if blood pressures are out of control and you get a COVID-19 infection that is a severe infection, it is very likely that you can be so critically ill that you don't survive. So stay on your medications. Now, antivirals. Those are medications designed to actually kill the virus. We have none available. The ones associated with treatment for AIDS have not been successful. The ones associated with treatment for hepatitis have not been successful. There is some suggestion that there was an antiviral developed in Japan for Ebola infection in 2016 that may be effective, and that medication is being actively studied. But the other antivirals on the market that are associated with treatment for HIV and hepatitis have been tested, and they have not seemed to make a huge difference. And it's been actually very disappointing. So antiviral medication to kill the virus is being studied, but there are none available that we're aware of that actually work against COVID-19. So treatment. So what does that leave us? That leaves us with the understanding that when we treat, we're treating to help the patient stay alive until their immune system can fight off the infection. That's the bottom line. If you're having difficulty breathing and need assisted oxygen, even if that goes to the point where you're just needing oxygen but not a ventilator, those are the patients that are typically being hospitalized. And critical infection is when people are unable to breathe well enough on their own to keep their oxygen levels up. And oftentimes they're ending up on ventilators. With the notion that we're there supporting breathing, while their immune system is trying to fight off the virus. Certainly, if patients are having significant diarrhea, if they are so fatigued and so ill that they can't eat and drink and they are not able to stand up, they may not have normal consciousness, what we call talking out of their heads. Those type of things also need attention. Patients may need some mild IV fluids. So the type of treatment that we have is supportive care to make sure patients stay alive until their bodies can fight off the infection. One of the things that we're starting to understand is that in severe and critical cases, patients are starting to demonstrate issues with kidney failure, issues with liver dysfunction, and issues with cardiac dysfunction. And a significant number of patients who have died as a result of problems with their heart that were not underlying heart disease necessarily. So we continue to learn more about this virus, what it's doing, how the infection acts differently when it's a severe infection versus a critical infection versus a mild infection. And we may need to tailor treatments based on those stages. That's it. This is the end of our medication and treatment. It's thankfully short and unfortunately short because we just don't have a lot of answers in terms of proven treatments. We will talk about immunity and boosting the immune system on a different talk because there are things to consider before we go too aggressive with that. We've gone through days 1 and 2. Again, I'm going to go back through and edit and condense those into a shorter lecture. Today's topic was day number 3, medication and treatment. Tomorrow, we're going to have our live question and answer. The original plan was to have a featured physician, but with the technical difficulties, we'll just have a question and answer tomorrow. And I will do my best to make sure that those technical difficulties are taken care of so that we can have someone featured on Sunday. Join us tomorrow at 6 o'clock Eastern Daylight Time here on my professional Facebook page, which is Donna G. Ivory, MD. If you would like to have someone get a copy of this video that can be emailed to them, they need to send us their first and last name, their email address, and a request for us to send the video to them, and we will get that done. I hope you're having a fantastic evening. We know it's hard to stay home. We know it's hard to stay isolated, but we need to do our best to participate in the physical distancing. We need to do our best to make sure that we decrease the likelihood of getting infected. Be calm, be patient, because this will take some time, but be grateful for the things that we do have. And I thank you. We'll talk to you tomorrow.